Special events in the two Virginias, issues that matter to you, people making a difference. This is In Focus on WVVA with your host, Courtney Clark.
Good morning and welcome to In Focus. Thanks so much for joining us. I'm Courtney Clark. November is Lung Cancer Awareness Month, and that is our focus this morning. I'm pleased to be joined by two doctors from Clinch Valley Medical Center. Today I have with me Dr. Sami Jawad and Dr. Michel Bidros. Thanks for being here, gentlemen.
Thank you. Thank you.
Well, tell us a little bit about lung cancer, starting with the facts.
Well, some facts about lung cancer. First, it's a very prevalent disease. It's even more common than we think. And that's an extremely unfortunate thing. If we look at worldwide, there's almost about 1 to 2 million people that would die from lung cancer each year. And unfortunately, we're expecting this number to go as high as 10 million by the year 2030. The numbers in the United States does not look any better, as roughly speaking, we have about 150,000 people die each year from lung cancer, with about another 200,000 diagnosed each year with lung cancer.
And Dr. Bidros, it's often thought that lung cancer and smoking go hand in hand, but sometimes that's not the case. Are there other risk factors?
Yeah, almost 80 to 85% of lung cancer are due to smoking. However, excuse me, 15% of all lung cancer are not related to smoking. Secondhand smoking, let's say, probably it's 5 to 6% of all lung cancer are related to secondhand smoking. Also, industrial exposure, and also family history of lung cancer, and also exposure to radon. And probably genetic susceptibility to lung cancer also is there, as we can see some clustering in lung cancer cases in families. So it's unfortunately smoking is number one culprit for lung cancer. However, there are also other factors can predispose patient to a lung cancer.
Does it seem that with the awareness of smoking and different programs now, cessation programs, that the lung cancer rates are going down?
Not really, not that much. And to be honest with you, from my experience in my office, I'm kind of having difficulties in convincing patients to quit smoking, even patients with lung cancer. They keep smoking even with the lung cancer. And in fact, I have a patient who has 2 smoking-related cancers, and he doesn't want to quit.
Because it's so addictive, or?
Exactly. It is addictive.
Well, Dr. Jawad, why would you say we need to be so concerned about lung cancer now?
Well, there's a few reasons to make us more concerned. First of all, the earlier that we diagnose the disease, the earlier we find about it, we have more options or more stuff that we can do about it. And we will talk soon about the different treatment of lung cancer. The other thing is it's a serious disease, and people can die, unfortunately, in a short period of time if we don't do or act fast about it. The other importance, it's relatively speaking preventable disease, with smoking being the biggest risk factor. And by cutting smoking, you're relatively speaking eliminating your risk to have lung cancer in the future.
And what do you think about e-cigarettes? Would you advise against that as well?
That's a difficult question. And unfortunately, we still don't have enough data to prove or disapprove that e-cigarette would cause lung cancer. It's still too early to make that decision. Right now, we have only very limited data about COPD, that e-cigarette is not as nasty or as bad to your lungs causing COPD as much as actual cigarette does. Regarding cancer, we still don't have enough information. There's many reports coming out looking into that. And my recommendation is it's better to stay away from e-cigarette for now till we have more information, and whether it will increase or cause or predispose you to lung cancer in the future.
Why does it seem that lung cancer is diagnosed so late? I know you say prevention is key. Why does it?
Unfortunately, till recently, we did not have a right or a proper test that will detect it early. And in the early stage of lung cancer, most of the times it's not symptomatic. The patient will not have any specific symptoms. And many times you will have very non-specific symptoms, especially in smokers, because smokers usually believe that being short of breath is a normal thing. Having coughing up some blood could be a normal thing. It's related to the smoking. And they have a lot of denial in that. They try to deny their symptoms. They try to hide it. That's why most of the time it's really late, and when the patient present, they will present, relatively speaking, in an advanced stage of their cancer.
Sure. And Dr. Bidros, talk about the prevalence of lung cancer here in our area.
Okay, I just want to add something to Dr. Jawad's answer. Unfortunately, most of our patients are in denial, and as he said, they contribute the cough to what's called the smoker cough until the cancer is very advanced. Things that our patients should be aware of: smoker cough shouldn't be an answer to the cough, especially when the cough changes its characteristics. And blood in the sputum also is an alarming sign. Weight loss, fever, night sweats, all these things are alarming signs. So patient and families should be aware of those alarming symptoms. The incidence, I'll go back to your question, the incidence of lung cancer here in this area, or in the United States in general, it's probably 50 to 55 cases per 100,000 people. In our area, it's about 90 cases per 100,000, which is almost 1.5, or almost, let's say, probably a double the incidence of lung cancer here in our area. And most likely it's related to smoking habit here, and also the exposure to coal mining.
Absolutely.
Yeah, if I add also to Dr. Bidros, unfortunately in this area I have more prevalence of lung cancer comparing to the other states or other areas of the country. And that goes hand to hand with the smoking, because unfortunately 17% of the adults in the United States smoke. Here in this area, the percentage is slightly higher. There are about 20% of the adults around this area actually smoke. And I believe that's contributed to the reason why lung cancer is more prevalent here compared to the other states.
Sure, and I know you touched on some of those symptoms. Can you tell us those one more time?
So again, cough, shortness of breath, night sweats, fever, chest pain, or if a patient feel like a lumps or bumps in the neck or here in the armpit, or anything in the skin, can be an alarming sign.
And would that be something they experience early on?
No, actually, those are like kind of late manifestation of lung cancer.
So what would you say the typical diagnosis is? I mean, stage, do you have a certain,
unfortunately, unfortunately, lung cancer, especially in early stage, is asymptomatic. So your patient wouldn't feel it until they are in very advanced stage. Okay,
and what are the common treatment options?
Well, basically, the treatment is based on the stage. Early stage lung cancer can be treated with curative intent surgically. Sometimes we might add chemotherapy after surgery to stage 2 lung cancer. Stage 3 lung cancer, where things start to get muddier and more complicated, some people might treat lung cancer, or some expert might treat stage 3 lung cancer with upfront chemotherapy and radiation followed by surgery. Some other people might treat just with chemotherapy. Depends on the patient lung function and general performance status and health status. Stage 3B, in stage 3 patient, 3B patient, usually there is no role for surgery, just only chemotherapy and radiation. And stage 4, basically just a palliative treatment with chemotherapy. Sometimes we do use radiation therapy for palliative intent, like to control the hemoptysis, which is spit in blood, or to control pain if patient has severe pain. Those are like the general principles for cancer, for lung cancer treatment.
And what are the survival rates for the different stages?
It depends, if it is like early stage, probably the 5-year survival is 50%, but the more advanced stage, let's say stage 4 lung cancer, the 5-year survival is probably 1 to 4%. So it's very dismal.
Absolutely. All right, well, it's time to take a quick break, but don't go away. When we come back, we'll be talking more about lung cancer and about steps for prevention. Stay with us. Good morning, I'm Courtney Clark. Welcome to In Focus. If you're just joining us, today's focus is on lung cancer, as November is Lung Cancer Awareness Month. I'm here with 2 doctors from Clinch Valley Medical Center. Thank you all for being here.
Thank you.
So, Dr. Jawad, let's just start by focusing on why lung cancer is so deadly.
Well, it has to do with the way the lungs work. As we know, we can't live without our lungs. We need it for breathing, and the space that the lungs are in is very limited, and there's no place for it to expand. So people would die from lung cancer for different reasons. One of it is the mechanical part of the lung cancer to occupy part of your function. And as we spoke earlier, most of those patients are active smokers, or they smoke, and they already have significant lung disease. So they can't afford to lose part of their lungs. Unfortunately, also the treatment will put more burden on the lungs and on the patient's symptoms and the breathing. The other complication of the cancer itself, which can be fatal, with the major one being coughing up blood or bleeding. And unfortunately, even a small amount of bleeding in the lung can be fatal in some situations.
And what groups are most at risk other than smokers?
Anyone who have been exposed to different chemicals or fumes, they will be at high risk. To be more specific, asbestos is one of the big risk factors. In the old days, asbestos used to be used much more than now. Fortunately, now we have more restriction about its use, but still it's there in some industries, and one of them is mechanics, where brake pads, they still have a lot of asbestos, and exposure to that will increase your risk for lung cancer in the future. Being exposed to fumes, dust itself can also increase your risk. So those are other risk factors other than actual smoking that will increase your chances for having lung cancer in the future.
Absolutely. And as someone who specializes in cancer, Dr. Bidros, why do you think that breast cancer or prostate cancer seem to get so much attention from the media, and lung cancer, you just don't hear about it quite as much?
Well, lung cancer, unfortunately, the prevalence of lung cancer is not as big as the prevalence of breast and prostate cancer because of the survival rate. Patient with breast cancer or prostate cancer can survive, up to, like, depends on the stage, can survive from 2 years to 20 years or even more. Same thing apply to prostate cancer, which is the same concept. Any hormone-dependent cancer, it's kind of slow-growing cancer. On the other hand, lung cancer, it's not hormone-dependent cancer, so it's very aggressive, and it tends to spread to distant organ, like to the liver or to the bone or to the brain very early. So it's kind of difficult. To treat, and also patient don't live as much as the as much as the breast or prostate cancer. So the incidence would be lower. So that's why the breast and prostate cancer get more attention from the media, because we have more prevalence of those type of cancers. Patients with lung cancer, they die quicker.
That makes sense. And Dr. Jawad, can lung cancer be located in different parts of the lung?
Yes, of course. It can occur basically in any part of the lung, and usually we divide lungs to different segments, different lobes. Lung cancer can present in any of those lobes. Also, it can occur in the inside the lungs or inside the tubes, the bronchi. Also, it can occur in the covering of the lung outside the lung themselves, either as a primary tumor or extension of an actual tumor that starts in the lung.
And how does that affect the diagnosis? Is it better to locate it in a certain area?
It depends. Sometimes it differs with the stage, and it differs with the type of the cancer. Some type of lung cancer that happens in people who are exposed to asbestos actually start in the pleura, which is the covering of the lung. We call it a mesothelioma. And unfortunately, it's a very aggressive type of tumor. Usually, any tumor that involves the covering or the outside of the lungs is an aggressive type of tumor. Also, it differs with the stage. In people who have their tumor extend outside the lung, that means they are in advanced stage or already in a late stage.
And are there different ways to get screened for lung cancer now? I know you said there used to be no way really to find it until you started having symptoms.
Well, till recently, we had nothing to help us finding lung cancer early on. Nowadays, we have what we call a low-dose CT scan, which is basically a CT scan, regular CT scan, which is a detailed image of the lung with a lower exposure to radiation, so minimize your risk or your exposure to radiation. We found that people who are over the age of 55 with a significant history of smoking, who have been smoking in the last 15 years, if they get a CT scan every year, that would actually help us to detect lung cancer in early stages and will lower the mortality with a significant improvement or significant detection of lung cancer. So basically right now we recommend anyone who smokes or is actively smoking who's over the age of 55 to get at least one CT scan, a low-dose CT scan every year.
And that's relatively new. How long have you had that at Clinch Valley Medical Center?
We had a lung cancer screening program started a few months ago in Clinch Valley, and now we offer that to all patients who are actively smoking or been smoking in the last 15 years. At least for the last 34 months, we had it.
And after the screening, how do you diagnose lung cancer?
Well, it's a multi-step approach. First, after we do the CT scan, we review that with the help of our radiologist. And first, whether you have something in the lung or not. And not everything inside the lung is lung cancer, because you can also have benign spots or benign lesions. You can have infection that can present like a mass inside the lung. So the second step will be finding out what it is. And depend on the size. Sometimes if it's small, all we have to do is just to repeat the scan in a few months and to see if there's any change in size. If there's no significant change in size, and depend again on how big is the lesion, we decide how soon or how often we will need to do the scan. Now, anything large, and relatively speaking, we're talking about a 1 centimeter or 10 millimeter, which is almost about half an inch, then we have to do something about it. And we can approach it usually with two ways. Either we get a more detailed image or a certain type of image that tells us how active this spot is, or we just go ahead and try to biopsy that. And that can be approached with different ways and depend on the location of the spot. Either we do that with the help of our interventional radiologist by placing a needle and try to take a sample of the lesion that you have, or we do that through a scope that goes through the nose down to the lung where we can locate the lesion and try to take a sample of it.
All right, well, it is time for another break, but we'll be right back. And when we come back, we'll be taking a closer look at how lung cancer is treated. Don't go away. Good morning and welcome back to In Focus. Thanks so much for joining us. If you're just tuning in, our focus this morning is on lung cancer, and I'm here with two doctors from Clinch Valley Medical Center, Dr. Sami Jawad and Dr. Michel Bidros. Thanks for being here.
Thank you.
So we've talked a lot about lung cancer and how it's diagnosed, with this being Lung Cancer Awareness Month. Dr. Bidros, can you tell us how it's treated?
Okay, again, as I said, it depends on the cancer stage, if it is early stage versus advanced or metastatic stage. Early stage, as I said, we usually treat with curative intent, which means we try to make the patient cancer-free. So we try our best. We try very aggressively. We send the patient, if he has a good lung function, we send them for surgery, and depends if they have stage 2. If it is like a little bit more advanced, then we do surgery followed by chemotherapy, and then if it is stage 3, we give like upfront chemo radiation followed by surgery, and the more advanced stage, like stage 3B, we treated with chemoradiation, and stage 4 it basically just palliative. The the good news right now is we have not just we have chemotherapy options, we have also immunotherapy, which has way better toxicity profile, which means less side effects and better tolerated. And it depends on the patient cancer histology. There are like many options for immunotherapy with less side effects than the conventional chemotherapy, which is, as you know, most of it is kind of toxic and very harsh.
Mm-hmm. Well, Dr. Jawad, what can someone do to prevent lung cancer?
Oh, well, this is the fortunate part about lung cancer. Very few cancers that you can do something to prevent them. For example, breast and prostate, which are the two commonest or prevalent cancers, there is no way to prevent it, unfortunately, and all you have to do is screening. On the contrary, lung cancer, the main thing is smoking. This is the biggest thing, and this is what we keep stressing in our patient. Don't smoke, don't start it. Teach your kids, your neighbors. The best thing is not to start smoking. And even if you smoke, there's other ways that we can help you. Speak with your physician, your primary care, your pulmonologist, what they can do to help you, because we have some medication, some method that can help to stop this habit.
Sure. And what is the rate of survival for patients with lung cancer? We've talked about how deadly it is.
Well, again, as Dr. Bidros explained, it's really with lung cancer, it all depends about the stage. Early stage, with everything that we can do with the surgery and the close follow-up, the 5-year survival, which is the way that we measure people's response to treatment, is about 50%, which is still, relatively speaking, low. If we look at stage 4, unfortunately, people are expected to live 5 years, 1 or 2%, that's all. When we talk about other type of lung cancer, even the numbers look even worse than that. With the extensive disease, less than 1% will live for 5 years.
Wow. And Dr. Bidros, would you say that lung cancer is predominantly a disease of the elderly?
Not really, no. I do have many like young and middle-aged patients, you know. So it's not like just the disease of elderly. Probably because of the change in smoking trend and smoking habits. Now we see, you know, smoking teenagers, smokers. It's a problem. It's a national and international problem. It's not just in our area.
Do you have any data regarding how long lung cancer could take to develop after someone starts smoking?
It's really very difficult, you know, and it's very difficult because we cannot really tell when the lung cancer has started. So that's very difficult to measure.
And once again, highlight those symptoms for us. I think that's important for anyone who's watching and may not be paying attention.
Yeah, so again, you know, cough or chest pain or spitting up blood, fever, night sweats or weight loss. Those are the alarming symptoms.
And Dr. Jawad, if someone's watching and they do want to get help to stop smoking, do you have any programs available at Clinch Valley?
Well, usually we try to set a plan with them, and the first step starts by motivation. The patient needs to be motivated. It's all start in your mind. The first step you want to quit, and you have that to be well established. After that, we can offer them a few options, and the simplest one will be replacing the nicotine, whether through a patch or a gum, or whichever the patient would prefer. And in addition, we have other medication that can take the edge or the stress away that the patient would experience from quitting smoking. So yes, we have many options for them, and as I said, starting with simply just replacing the nicotine with other options than smoking, to more advanced therapy like some medication and pills.
And what should someone do if they recognize the symptoms Dr. Bidros mentioned, or if they've recently been diagnosed with lung cancer?
Well, first, if they start noticing the symptoms, they have to discuss that with their primary care physician. And the primary care will decide what the best next step will be. And most of the time, it starts with an image of the lung. And usually, we prefer to go with a CT scan rather than with a chest X-ray, because unfortunately, chest X-ray will not give you much details, and it can be negative while there's a very small, because it will not show you a very small spot. And chest X-ray is just simply a reflection of shadow, while when we do the CT scan, you actually look inside the lung. And this is where they should start by a discussion with their primary care.
And the low-dose CT screening, when should that begin? Did you say 55?
At the age of 55, we recommend active smoker who's been smoking for in the last 15 years to have a yearly CT scan.
And would they just talk to their primary care provider about that and, and get that?
They need, yes, they will need to discuss that with the primary care physician, and we leave that to the primary care whether they're comfortable ordering the scan or they prefer to refer them to a pulmonologist to start the process of the screening.
All right, well, we have less than 2 minutes left. I'm just going to open this up to you all. Dr. Bidros, is there anything you'd like to say to the community regarding lung cancer?
You know, again, you know, the smoking is number one culprit in cancer.